Oh, hi. So I'm Janet. I am a second-year resident in the primary care program. I'm from California. That's where I grew up and went to school, at med school, and moved out here to New Haven for the Yale primary care program.
My name is Monet MPEG. I'm also one of the second-year residents in the program. I grew up in Minnesota, and I'm also in the Yale primary care program, quite obviously. One of the things I wanted to talk about is just what I've found so compelling about the program here. And coming out of med school, I had a lot of trouble finding a community of people who were really invested in what I thought medicine could and should be. And coming here, I found among our group of fellow residents and attendings people who don't look at just the patient in front of them, but really think hard about the system and the community that patient comes out of. And I found that among our fellow residents, they've had sort of stellar experiences doing all sorts of different work in the community and with patients, and really getting involved with advocacy efforts in a way that I found compelling. So one of the things that we've worked on is a group called Yale Primary Care Progress, which is trying to sort of reinvigorate that excitement around primary care by bringing in speakers and ideas around what's new and novel, and how can we use the work that's going on by these attendings and bring it into our clinics and our practices.
Yeah, so it's actually a national organization, and we were part of, I guess, the startup of the chapter here in collaboration with community members, people from the nursing school, public health school, the medical school, and it's actually part of a larger collaborative that includes business and management people as well. And so it's a very vibrant primary care focused community that's here. I guess something else that we were able to do as far as reaching out to the community, since we're both in Waterbury and New Haven, and they're kind of they're disparate populations. So our clinic is in Waterbury, and to help integrate ourselves more, the primary care program holds this Waterbury Health Fair every year. And it's just a day that the residents can come meet community members, do a lot of public health or primary care screenings, education, preventative medicine. We're working with community specialists and other organizations in Waterbury to hold this day for the community that we work in. I guess other things that we've actually worked on, which I think are largely possible because of the great support and encouragement that we get from our mentors and faculty advisors here, is the Waterbury Transitions Project.
Yeah, so as I mentioned, one of the things that we've been able to sort of work with other attendings who are interested in the transition from hospital to home. And some of the great work that's going on at Yale, we've wanted to ensure to bring up to Waterbury as well. So we're looking really hard at what are the reasons for patients getting readmitted, and what are the ways we can better understand that process and ensure that when we're actually discharging a patient, we are ensuring a safe transition home, and looking at all the things that might factor into that, whether it be their ability to get medications, their understanding of their disease, their ability to get transportation to appointments, the quality of the discharge summaries that we do. So, that's all because when we proposed the idea, we were able to immediately find support among the faculty that said, "Hey, yeah, we want to work with you on this, and let's run with this." And I think that it's been really great over the last couple of months trying to put this project together.
Right. And I guess just the background is it started very organically with us being on the floors. So we were on the floors at Waterbury. I happened to have 2 months back-to-back of floors, at which point Monet was my day flow, and we had just noticed like a large number of our patients that we had taken care of the first month were all coming back the second month, and something seemed wrong. And so we talked about this, did a little bit of background reading, and then brought it to some of our attendings and advisors, and they encouraged us to continue to figure out what was wrong, to see if there were things that we wanted to do about it. So it's very exciting.